So tell me about what made you first come in to do hair transplants.
The reason that I first came in to do a hair transplant, when I was going, my hair was getting thin slowly. And last July I got married, and I was looking at my wedding pictures, and they were beautiful, but they also were very traumatic for me because I looked at our first kiss and all I could see was the crown of my head, and I could see my scalp, I could see through my hair. And then I looked at our first dance, and the same thing, Michael was hugging me really closely, and all I could see was the crown of my hair and my scalp. And then we were cutting the cake, and I was looking down, and all I could see was my hair loss. And I thought, I have to do something about it. It's gone too far, and I have to do something about this. A worry that I had about the transplant is that I didn't have enough hair to cover what was needed, because it seemed that I had let it go too far. If I had done something earlier, laser, or just really taking care of it earlier, I would have been more confident. But one of my fears was that I wouldn't be able to cover the hair that was lost. Another is the surgery. It's actual surgery, so just not knowing what to expect with the surgery, not knowing if it would be very invasive, not knowing what I would look like afterwards was a worry a little bit to me.
And once you went through the surgery, how did that surgery day go?
The surgery day was actually very relaxing. I came in early, and the staff and the doctor and everyone, the nurses, everyone is very welcoming and professional and friendly, and they relaxed me. During the surgery, of course, they give you Valium to relax you, and it wasn't bad at all. It wasn't as bad as I thought it would be. It didn't hurt, and it went very quickly. It seemed, even though the day it took quite a long time, it seemed to go very quickly for me.
How about the pain the next day? How did that feel?
I can't say that there was a lot of pain. It wasn't comfortable. It was a little bit uncomfortable. One of the things that you have to do is sleep at a 45-degree angle, and that was probably more uncomfortable to me than the actual surgery itself, than my head itself. One thing that felt a little odd was I was a little numb, and I was numb for a while. So that was probably the oddest feeling. A little bit sensitive and a little bit numb, but really not as bad as I thought it was going to be.
Good.
I had 3,175 grafts.
Okay.
For some reason, I'll never forget that number. And I was pleased that there could be so many.
Yes.
That I felt that that's great, because that way I'll have more coverage, and it was quite a bit.
So we did 600 single hairs in the anterior hairline and the temple area, and then we did 2,575 follicular units down the vertex into the mid-scalp. So now what we're going to do is we're going to take a closer look at where we place those grafts.
Okay.
4.5 months ago, we had a hard time finding the scar, but it's right here. And what Dr. Friedman did is he did the trichophytic closure, and we did it from on the back of her scalp. We started right from the back of her ear all the way here, because we needed to harvest as many as possible. And so what Dr. Friedman did is he was able to induce the hairs right through the scar, so that when she put her hair up or anything else, that it was not able to find the scar at all. And so in about 6 months, we'll notice that this will start to fill in. 9 months, all of the grafts will be growing. At a year, they will be to full maturity. So we're very pleased so far with how this is looking, and we can't wait to do the 6-month follow-up.